treatment of pertussis or whooping cough. The third phase of the disease is called as recovery stage or recovery phase. Its duration is from 1 to 2 weeks. Proper treatment and careful nursing, rest, and the other prophylactic measures, if adopted, the pathological changes in the upper respiratory tract airways is reversed into the physiological and anatomical conditions. Treatment is very simple. First, we perform the diagnostic tests like blood culture sensitivity, nasopharyngeal secretion culture sensitivity, and the appropriate antibiotics are chosen to eradicate the Bordetella pertussis bacteria. At this stage, we mostly use erythromycin, azithromycin, and clarithromycin medicines, while these are called as the microlids drugs, while the other drugs, they have limited efficiency and efficacy. Now, actually the complication of this pertussis disease is there is collapse of the alveoli due to the repeated fits of the paroxysmal cough, due to which the air entry is blocked and the alveoli are empty, there is no air in the air sacs. So there is production of cyanosis, apnea. For that we have to adopt rehabilitation measures, that is oxygen therapy is done, and if there is signs of dehydration, we have to rehydrate the patient. This disease is very critical and deadly in the infants, especially under 1 year age, and the elder one, especially those who are not vaccinated. So primarily it is easy to treat this one, but this process of coughing that encompasses, that is the period of this coughing procedure is from 2 to 3 months. That is why it is nicknamed as 100 days cough disease. And due to specific production of the high pitched sound, gasping and hacking sound, which is called as whoop, so that is, it is also termed as whooping cough disease, and it is produced by pertussis, that is Bordetella pertussis bacteria, which is a bacteria and it is an aerobic bacteria, and it is killed by the azithromycin, clarithromycin and erythromycin drugs very easily.